This is Dr. Ted Siciliano of the Manahawkin Chiropractic Center, Marietta, New Jersey. And today we're going to do resistance band training for spinal rehabilitation. Now I've developed this little program so it's to rehab primarily different areas of the spine, and for that we're going to use these resistance bands which have a little handle with little resistance tubing. We're using this because it's low cost, it's inexpensive, it's lightweight, it's easy to store, and it's portable. You can take it anywhere. It has consistent resistance to it, so it's very efficient and effective for what we're going to do. It's time effective and it's safe. I would recommend that if you do this, that you're under the guidance of a physician, so don't try this at home arbitrarily. We're using the yellow band, which is the lightest resistance that you can buy with the Thoroughbrand brand, and we recommend Thoroughbrand because it is a high quality resistance band. So for the first exercise, what we want to do is you want to step with both feet on the middle of the tube, and you want to bring your hands out where you're taking out the slack of the tubing, and then we start with what we call flies. You come up, down slowly, up, down slowly, up, down slowly. We got the slack out of the tubing, down slowly, okay? Flies. Then we're going to go to front raises, where you bring the tubing in front of you, keeping the slack out, and then we raise to shoulder height. Up, down slowly, up, down slowly, up, down slowly. Okay? And then you can, whatever you want to, how many repetitions you do. If you're a beginner, you want to start with 6 or 8. If you're a little more advanced, then you want to increase it to 10 or 15. But start out slowly. Next one, we're going to go to biceps, which is basically the curls. Okay? You want to focus on bending the elbow, okay, keeping the shoulders steady, right? Biceps. Next one, we're going to do the shrugs, where you let go of the handle, you grab the tubing, okay? Keep the elbow straight, and you shrug your shoulders. It's going to get that upper levator scapula, the upper trapezius, and the neck muscles. This is terrific. This is what we want for the neck rehabilitation. Okay. When you're done with that one, you want to step in the middle of the tube. Okay. One step forward slightly, and you want to bring the tubing behind you with your elbows bent. And then what you do is you bring your hands up like that for triceps. Okay. Now I'm going to turn around so you can see what it looks like from behind. Okay? Okay, ready? Triceps. Okay, good. Now, we bring these down. We're going to take one step forward. Bend at the knee. Arms out in front. Shoulder height. And we're going to do some raises. This is for the upper trapezius and the cervical spine musculature. This is for your neck rehab with the shrugs and the front raises. Okay? Then from that same position, you put the hands into the gun position, like you're going to punch, and then you push up and down slowly. Push up and down slowly. Push up and down slowly. Up and down slowly. That's for the latissimus dorsi, which helps with the low back pain. Next one we want to do is we're going to step both feet back on the tubing again. Hands into the guns. And we're going to do what we call the breaststroke, which is you want to punch up and come around 1, 2, 3, 4, 5 slowly. Bring them back to the guns. Push up. 1, 2, 3, 4, 5, 6. Push up. 1, 2, 3, 4, 5. This is for the latissimus dorsi again. Down slowly to get the negative. Push up. 1, 2, 3, 4, 5. Okay. Now the next one, we want to step 1 foot back and cross the handles. Okay, so we're in this position. And from that position, we want to do what we flies. This is going to get the upper back. Down slowly, up and back slowly. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now I'll give you another alternate exercise for the trapezius, and that would be basically to step on the tubing. So it's one side's longer than the other side's shorter, and you can do what we call a kickback. Put the elbow here and you just kick it back like that. This is for triceps. If you don't like to do it over your head or you got a shoulder issue, this is a good one to do the triceps. And then you just switch feet and basically do the same thing. Right? Bend the elbow. Now this is all the movement from the elbow. It's like a pendulum swing at the triceps. Good. Okay? Now, that same position, you step on the tubing with 1 foot again. Okay? And what we want to do is do the rotator cuff, and you want to bring that tubing about 45 degrees across the body. So what we want to do is we'll bring it up and down slowly. Up and down slowly. Up and down slowly. Up, down slowly. And same for the other one. Switch it. You got the short end on the side you're going to exercise. And up, down slowly. Up, down slowly. Up, down slowly. Okay. Now, we want to do the upper back. So you want to grab the end of the tubing, not grabbing the handles, arms out in front, and you stretch to here, and the exercise is 1, 2, 3, 4, 5, 6, okay? And come back slowly, always back slowly. That's for the upper back. Now to do the chest, just put the tubing behind you, and there's 2 ways to do this. One is you bring your arms together. Okay, it's going to get closer to the shoulder, but it's going to get those pectoral muscles real good. And if you like to do bench presses, you could make sure the tubing's behind your back, push out, like that, okay? 2 ways to do the chest. Either one is good. Now we're going to move down into the glutes, the gluteus maximus for the low back. So we want to step back on the tubing, maybe shorten up the tubing just a little bit so you get some strength, and you bring this up to the guns, maybe shoulder height. And what we want to do is we want to do squats. So you're going to sit down and come up. Like you're going to sit down on a stool behind you, sit down and come up. Okay, like you're going to sit down. Form for this is very important. So it's just you're going to keep that spine straight, but you're just going to bend from the hips. I'll show you what it looks like from behind. Okay? Hand, shoulder height. You're going to go like you're going to sit down and come up. Sit down and come up. Okay, sit down and come up. If you have never done these, you want to start off with a minimal amount. 5 or 6 is plenty for starters. Another way to do that is to bring the tubing over the shoulder, crisscrossing it. It's a little more complicated, but you get a little more resistance with this. And what you can do is you go, like you can sit down and push up. Sit down and push up. Okay, down and up. And I'll show you what that looks like from behind. Okay? You sit down and come up. Sit down and come up. And one more, and come up. Okay, that's squats, that's for the glutes. Now in this same position, we're going to do some sit-ups standing up. And the way it is the arms are crossed. Right, you get some resistance by spreading the legs, and basically you just do a sit-up, a bend forward. You can feel the resistance of the tubing pulling you back in the upright position or erect. And when you come forward, you contract your musculature, you contract your abs, contract those stomach muscles, and come back slowly. 1 contraction, relax. 2 contraction, relax. 3 contraction, relax. Okay, we're doing real good, and we're coming to our last exercise, which is what we call a kick out. This is for the glutes, for the gluteus maximus and the upper hamstring. And what you want to do, this is going to be from behind, so excuse me. You want to step on it with your heel and put your hands against the wall like that, and then you take it and just kick out like that. Nice and easy. Gets the glute and gets that upper hamstring. Okay, you want to just do 4 or 5 of them, especially if you're starting out. Same thing here. Hands against the wall and push out. Nice. It's the glutes. So, there you have it. There's 15 plus exercises, all done in the standing position with a light, easy, efficient, low-cost exercise unit. You don't have to go to the health club. If you have time, you go for a little walk, get a little cardio going, 10 minutes, come back, and you go through this little program. If you're a patient of mine, certainly I've instructed you to do about 4 or 5 of these. If you're new at any kind of exercise training, you want to go real slowly because you don't want to hurt yourself. If you're not my patient, please call your doctor and ask him if these exercises are okay. So I would recommend that you're under the instructions of a physician. If you have any problems, please call my office. I'll be more than happy to help you out. 609-597-9333. Thank you.